We're very excited with where we are in the Tobacco Control Data Initiative program. When we began this program in 2019, there were just a few of us, and now we are over 50 individuals across 2 projects. So we have our DG Development Gateway team members and the CC team members.
Reflecting back on October 2023 when the sustainability phase started, and now in December 2025, I have full confidence on the experience that the CC colleagues have gained throughout the 2 years, some one-on-one trainings and some plenary trainings. But ultimately what we have seen is the CC colleagues take ownership of different deliverables, different outputs that they were responsible for.
To see how CC has brought in incredible team members from trusted organizations, from Ethiopia to DRC to Kenya and Zambia, we're excited about the expansion of the program into new frontiers, new areas, and to even more impact.
The TCDI 2.0 was quite great success in Kenya, whereby we saw the 2 pages go live on the dashboard. That is a youth prevalence page and the new and emerging nicotine and tobacco products page. And again, looking at the time at which these 2 pages went live in the dashboard, it made great significance in the country, because at the moment, of course, the tobacco industry is really targeting the young people, and the information in there has a lot of great impact in the country.
We're most proud of the successful completion of the prevalence spot check survey across 3 countries, which included Zambia. So as a result of this survey, we have more interesting insights into the prevalence of tobacco and nicotine use.
I think we have had new pages coming live, among which we had the page on agriculture. And there are so many arguments by the industry that agriculture actually leads to creation of jobs. But basically, when you look at the page that has come live and the evidence that it provides, it clearly tells you how farmers that are participating in tobacco production are subjected to contracts that are mostly oppressive.
In 2025, the other key activities we conducted was updating the 7 English pages with the data that were more recent. And not only updating those pages, but the 7 pages have also been translated to Amharic, and the implementation of the Amharic version of these pages is now completed. And in the process of translating these pages, we were also able to share the first 4 pages that were translated and implemented with key stakeholders to understand their take and to see their feedback on those translated pages. And we were able to see that they were really happy with the translation, because it allowed them to use the page now in a different way.
Last year, we validated with our stakeholders, the Ministry of Health, and all of the relevant tobacco control stakeholders in Nigeria, that they wanted to see 1 additional page on the Nigeria dashboard, and that was the new and emerging tobacco products page. This is a page that we've developed together with the CC team going well into year 2. And the reason that I'm so proud of it is that it's the first time that we've gotten a chance to kind of take a step back and let CC lead the process, because the first 6 pages or themes that are currently on the dashboard were worked on together with the stakeholders by TCDI DG team specifically.
We are very happy to see the good collaboration with the health inspectors, and what we found out during this collaboration and the training we did with them is that some health inspectors were not aware about tobacco control specific aspect. How to know that this cigarette pack is illicit. They didn't know about it. So that was a very big challenge. So we are happy that we did have this kind of collaboration to see that people are using our data, and it's helping even decision makers.
A big part of what makes TCDI so successful is the relationships with the stakeholders. And so even prior to the Kenyan delegation going to the COP, the two of us were involved in preparing the delegation in terms of providing them with the information that they needed to address the agenda items. And then, of course, during the COP, it gives us opportunity to engage with other government officials from the other countries where TCDI is involved.
We are at least proud for the achievement that we have made to participate to the tripartite meeting. This is the framework through which we can bring to the awareness of the other partner or stakeholder on what we have been doing. And this is the meeting which is actually gathering the government, civil society, and WHO. So through this meeting, we were more even proud to realize that in the delegation of the DRC at COP11, they even use our data that we just recently published on our site. So this is proving the reliability of our data.
As a country lead, we have been participating in different national events such as World on Tobacco Day and GAS 2024 Dissemination Workshop. So we were part of the technical working group, which is formed by AFDA, and we participated in those national events. So as a result, TCDI project, TCDI Ethiopia project has benefited from those events.
We interviewed key organizations, and in those impact assessment interviews, we were able to learn that stakeholders have really benefited from the TCDI dashboard pages that presented the data in a more organized way, which they were able to use in their trainings, advocacy activities. Other than that, one key achievement that was mentioned by a former colleague from the WHO was that the projections we did for taxation has really benefited the government in making taxation reforms, especially in 2024. And the stakeholders urged that such activities continue in the future.
We've deepened our engagement with Ministry of Health and civil society. We were part of preparations with Ministry of Health and Civil Society towards the Internal Legislative Committee meeting that successfully took place earlier this year. And this process was very key in advancing the tobacco and nicotine control bill to the next stage. So we are happy that we continue to be a trusted partner to our stakeholders, and we look forward to continuing to deepen this engagement in 2026.
We've had CC team members take charge of international campaign days, such as the World No Tobacco Day, which was single-handedly spearheaded by the CC colleagues. And this is through some of the support and mentorship that the team provided throughout the year.
One thing that really stood out was the social media campaigns and how the data on the dashboard was really used by the social media campaigns by different civil society organizations and even the Ministry of Health to disseminate information that was very key and very relevant. The World No Tobacco Day had great impact because of the messaging that went out through the different communication channels, social media channels, and the day itself was such a great success because having the cabinet secretary graced the occasion and even made great proclamations in terms of the graphic health warnings pending the implementation coming up early next year. We'll look at such as great strides in the Kenyan government and even in the Kenyan jurisdiction to tobacco control.
I am particularly proud of the webinars that we undertook in year 2. We had a total of 4 webinars, and in the 4 webinars, we had over 350 participants spanning 20 countries. What originally started as an idea to creatively disseminate some of our findings morphed into more people engaging with our content. A case study is of a stakeholder in Cote d'Ivoire that is not a TCDI country, actually reached out to us inquiring about the illicit trade methodology that we used in DRC and Zambia. They were curious to know if the same approach could be replicated in their country so that they also get a sense of what illicit cigarette prevalence is in their own country. So this is a testament to how disseminating findings, reminding people about the studies that we have conducted, how that can also impact other countries.
In 2019, this was a new sector for us. So we were new to tobacco control, and we were new to the kinds of data needs that our stakeholders were facing. And now that we have become more deeply enveloped and integrated into each of our focus countries, we're now looking to expand. And with CC, we have jointly gone into Senegal to conduct our 7th country assessment.
The Senegal team has joined the TCDI project, and as a first step of this project, we conducted an assessment mission to map all the actors involved in tobacco control, from government, civil societies, and development partners. We discussed about many issues related to tobacco control, principally issues related to tobacco control data use and access. So most of them highlighted that the TCDI project will help to centralize all these data in a platform which is easy to use. And in the next step, we will be organizing a co-design workshop to put together all the actors to discuss about what are the priorities, what are the data needs, emerging priorities that we'll be retaining for this project.
CC is looking at expanding the TCDI program to even more countries that need reliable, accessible data on tobacco control. We're very excited for the future of the TCDI program. We're confident in the direction and the vision that CC has to take this into the future. And we think this is a great example of what can happen when two organizations come together to unite to drive further impact.